Let's talk to an expert, shall we? Dr. Janet Scott's joining us now, a clinical lecturer in infectious diseases at Glasgow University's Centre for Virus Research. Good morning, Janet.
Good morning. How are you?
I'm well, thank you. How do you frame long COVID in the overall sort of picture of the pandemic? Where does it sit for you, and what would you like people to most know about it?
Okay, so long COVID is a post-viral condition, and as previous people have mentioned, there are other post-viral conditions out there. The same thing happens after other viruses like Zika, dengue, even Ebola. So this wasn't entirely unexpected, but not all viruses do it, and it does seem that COVID-19 is one of those that is hitting the chronic part of the disease pretty hard. We've got a much better idea now than we did, say, this time last year as to exactly the symptoms that constitute long COVID and also who might be more at risk.
So what are those primary symptoms? Talk us through it.
Well, I think we've heard from your previous callers, Lucy and Aisha. It's quite hard listening to those stories, isn't it?
Yeah.
But really, unfortunately, we're hearing stories like that all the time from the long COVID social media and from patients. Fatigue is right up there as the biggest single factor. Almost everybody reports some degree of fatigue, and a good proportion quite a debilitating problem. Breathlessness is not far behind, and then just after that, problems with sleeping, headaches, limb weakness, and this thing called brain fog, which in our research we've covered as memory and concentration problems. There's a huge list, actually, so it's definitely a multi-system disease, which means we're either looking at a few different syndromes that are coming in together, and a syndrome is a group of symptoms that commonly occur together, or one underlying cause that is causing all of it. So there's quite a lot of research still left to be done there. But really, it's occurring in such a high proportion. I think we can safely say it's at least 10%, but in our post-hospital surveys, it's almost everybody who has symptoms 3 months after they leave. We're looking at quite a large cause of ill health coming our way.
And is there a particular sort of segment of the population that's more vulnerable to developing it after having COVID, or is it sort of seemingly random? What do we know about that?
Yes, well, in our research with the SARIC, which is an international network of researchers, we're really seeing a pattern here that females under the age of 50 are coming off somewhat worse than other groups. Now, everybody's at risk, any age group, any severity, but if you have been really quite severe with your acute disease, so in intensive care or having to have supplementary oxygen, that leaves you open to a higher risk of long COVID. But even if you were young and fit and well and no comorbidities before you got unwell, you're still at risk of long COVID. And the younger women under 50 coming off worse than the men, 5 times more likely to report, less likely to report feeling recovered in our study, more likely to have a greater disability, twice as likely to have a worsening fatigue, and 7 times more likely to be more breathless than men at the same age, which fits in with some of the ideas as to what might be causing it.
Do we know anything about the correlation between the vaccine offering any protection and the degree to which, or the length of which, long COVID keeps going with somebody in terms of causing them, real quality of life symptoms?
Well, we can hope that the vaccine reduces the number of people getting long COVID and the severity of it, but I'm afraid we don't know that for sure yet. That data is not yet in. I'm supposing that the best way to avoid getting long COVID is not to get COVID in the first place.
Right.
So the way to do that is to make sure that you take up offers of vaccination and be careful around crowded spaces. And all the things we've been telling people to do over the past year, really: wear masks, avoid crowded spaces, wash your hands on a regular basis. If you don't catch COVID, you won't get long COVID.
But if you're a child, you won't be getting a vaccine anytime soon. So does that leave them sort of more vulnerable?
Well, the children are less likely to get severe disease, but they are by no means immune from COVID. And we've just published a study with our colleagues in Russia looking at children there who were in hospital with COVID-19, and about 30% of them end up with long COVID. And as we've heard from Lucy, unfortunately, her daughter has long COVID, and I think is featuring in the Panorama programme this evening. It's definitely affects children also. And yes, they haven't been vaccinated and haven't got the luxury of avoiding crowded places as they're going to school.
We've got quite a few texts coming in, Janet, from people who have sort of had chronic fatigue and ME for many, many years. Who obviously it's good news for them that so much research is now happening into symptoms that they've suffered for a long time. But there's a little bit of a resentment there of we've been suffering for years and years and years and feeling like nobody much is paying attention or pouring any money into that research. What is the correlation? Let's get your sort of definitive medical opinion between, because chronic fatigue, it's a post-viral malaise, isn't it? And when it could, as you've said, it's not new to have sort of a post-viral fatigue. But is it essentially the same sort of set of symptoms for the most part?
Well, we know with COVID, post-COVID fatigue and post-COVID syndrome, that there is, we know what has triggered this. We know that it was being infected with SARS-CoV-2, resulting in the disease COVID-19. Whereas, unfortunately, with chronic fatigue syndrome, we do not know what the trigger was. Now, many individuals can think back if they've got chronic fatigue and think, well, that was my trigger or this other thing was my trigger. But chronic fatigue syndrome is a much more mixed group of people with also a mixed group of symptoms. There's definitely some overlap, and I hope that the research that is going into post-COVID syndromes can help those also with chronic fatigue syndrome. But at the end of the day, we don't know what that trigger was with chronic fatigue syndrome. And the fact, if it is a post-viral syndrome, that's one idea, but it's not the only idea out there as to what might be causing chronic fatigue syndrome.
Let's talk about treatments, cures, how people are being helped, if they, and if they are being helped, how they can help themselves. What do you know about sort of relieving the symptoms so far?
Okay, so at present, given that we don't know exactly why people are getting long COVID, we haven't got a drug or a treatment of that sort that we can just give people and say, that's it, it'll all go away. So we're being inspired really by what is already known about chronic fatigue syndrome and other rehabilitation strategies, and using physiotherapy, yoga, rehabilitation, breathing exercises, mindfulness. My colleagues in Glasgow are running a pilot study, which you might hear more about in Panorama tonight, I think, on a holistic way of treating long COVID,
right?
Involving all of those things. Just a very small number of people, and it is a pilot study in that we hope that these things will be helpful, but we cannot know for sure till we've tried it in a group of people and see if it actually is helpful. So. It's being tried in a small group of people. We'll see if that's helpful. If it's helpful and it gets funding, then it'll get opened up to more people. So that's happening in Glasgow just now. There's also the Your COVID Recovery website, which covers all of those aspects and can help people feel through that for themselves. In terms of developing medications, we have to look more into our understanding of what's causing long COVID. And there are a number of theories. Possibly the most promising one at the moment is that it's an autoimmune disease. Some markers have been found that suggest that is the case, and that would fit nicely with our observation that women are that women are suffering more than men. That's usually the case with autoimmune diseases.
Oh, right.
And inside that, there are other ideas that it's a vasculitis, and that's a inflammation of blood vessels. And that, again, would fit in with autoimmune and fit in with that it is a multi-system disease. If that's the case, there are a number of existing drugs that are used for autoimmune diseases. So that would leave the door open to trying some of those out in a properly controlled clinical trial in the fullness of time.
All right, Janet, thank you very much for all that information. If you can stay with us, that would be wonderful. It's great to have an expert whenever we tackle a topic. Dr. Janet Scott, clinical lecturer in infectious diseases at Glasgow University's Centre for Virus Research. The phones are still open, 08085 92 95 00, if you'd like to share your experience of long COVID, or you can text us on 80295. Got another texter here who says, I developed post-viral fatigue nearly 20 years ago. Very mixed feelings when I listen to stories of long COVID. I'm hugely sympathetic to those who are suffering, but also resentful about the attitude that this is something completely new. There are many people who have suffered with chronic fatigue and the medical profession have ignored it. In my case, in spite of being diagnosed with CFS by a consultant, my GP informed me I was just unrealistic about the effects of ageing. The first 5 years were the worst, but I still have to be aware of stamina. Most people up until now have relied on alternative practitioners due to the attitude of traditional medicine. But I do wish all those suffering the best. That's from an anonymous texter. Thank you very much indeed for that. Text us on 80295. Of course, the standard network message rate applies. Let's go to the phone lines now and bring in Mariana. Morning, Mariana.
Hello.
Thank you very much indeed for joining us this morning. You were or are a long COVID sufferer?
I am, yes.
And you're also a pretty serious runner, is that right?
Yes. When I got COVID in March 2020, I was training for London Marathon.
Right. And what happened? Can you sort of talk us through your experience and where you are now?
I got COVID in March last year, so it's 16 months now, nearly. I was fit, healthy, in my 40s, marathon runner, and obviously, just like your previous speaker, didn't think it would affect me at all. Mm-hmm. I had it very mild. I wasn't hospitalized. And my only symptom was loss of taste and smell back then. I continued training for marathon with my friends. I ignored it completely. And a few months later, I started noticing some shortness of breath just when I was running. Ignore it again. And I think this is something people maybe don't know. Again, that, you might have COVID really mildly. You might have no symptoms, not much of anything serious for a few months. And then long COVID sort of kicks in. So for me, it was a long run. We did last June, after which I started experiencing really bad sort of cardio symptoms, chest pains, ended up in the hospital with what looked like a heart attack.
Oh, my goodness.
I checked over. Everything was fine. They said, there are no organ damage. It's all good. But unfortunately, from then, it's just all started, long COVID from bad to worse. And around Christmas time, I was feeling as a completely disabled person, couldn't walk, couldn't do anything at all. In fact, I had to sit down when I brushed my teeth. I had to sleep for hours after I would go to the bathroom or upstairs or downstairs. I could hardly walk between two benches in our local park.
And did you know what was happening? Had you been told, Mariana, this is long COVID, this is what this is? Or were you imagining all sorts of other sinister scenarios?
Obviously first it was quite unknown, but I think around last winter, it was quite obvious that this sort of symptoms fall into long COVID category because mainly because of the actually social media long COVID support groups where we saw a lot of people with similar symptoms.
And have you had any sort of treatment? Because I believe you go to sort of a long COVID clinic, is that right?
I'm under care of our local long COVID clinic, but the problem with this is that, there's still tests not available, and treatments only good in a way that if you have an organ damage, then they would send you,
right,
to this certain route. But if you just have this random sort of symptoms and they're up and down, then unfortunately it's still very much, everything just explained by long COVID.
Yeah.
And, even in long COVID clinic, when I said, I have mobility issues, I'm a marathon runner, but I can't walk, they would say, it's long COVID.
Right, and that's...
We'll hope it will settle eventually, but it's been 16 months now.
Oh my God, I mean, that's devastating for you. I mean, I would imagine, have you, I think in your notes we said that you're working with a trainer who is specially trained in long COVID. Is that to sort of, because one of the things as well when it comes to sort of a post-viral fatigue is it's not just about trying to get better, it's about trying not to get worse, because the less you do, then sort of your body begins to decondition, doesn't it? And the less you're able to do. Is that what you're trying to do? Is to sort of to keep to some level of sort of operational fitness?
Yeah. Exercises are so important for me, and we can't also disregard the effect it all has on our mental health. Because just recently I was diagnosed with severe depression and low mood as a totally a result of all of this. Because I had never suffered with anything like that before. But, so yes, I do try to continue exercises. I do try to go to gym every day, even if I can't do much. And if I can't do anything, then I would just go on the treadmill. I would hold on to the rails to make sure that, I don't fall. I will have this safety thing attached to me, and I will just walk for 5 minutes on the treadmill, just so I'm still doing something.
Just so you're doing something, even just as you say, mentally, it's just that thought that I've gone somewhere and I've done something today. But there will be days when that's not possible for you or for other people. If you can, Mariana, stay with us. Let's bring in and speak about your experience again to Dr. Janet Scott, who's the clinical lecturer in infectious diseases at Glasgow University's Centre for Virus Research. Janet, it's devastating, isn't it? You've got someone like Mariana who's, she's young, she's in her 40s, she's training for a marathon.
Yep.
And what struck me there, and that's something that I hadn't heard before, was she sort of, Mariana was saying she had COVID. It wasn't that bad. She felt like she'd gotten over it. And it wasn't until months later that sort of the long COVID sort of symptoms started to kick in.
Yeah, that's very interesting, isn't it? It must give us some insight into what might be causing it even. Absolutely devastating, all the stories we've heard, and unfortunately not uncommon. We do seem to be getting some clusters of symptoms here and there. From our research, we can say that the fatigue and breathlessness quite commonly found together, and I think that's what she's saying. She was saying that actually it was quite a long time afterwards, and then the first thing she noticed was breathlessness when she was running, and then it's kind of gone from there. So it's so important to get these patterns and to follow people up long term, not just to take a snapshot, say, 2 weeks after they left hospital and say, are you fine? Or 2 weeks. And if you're fine, that's a fine, you're discharged. And that's really what we're trying to do in the COVID in Scotland study, which is the large study between the University of Glasgow and Public Health Scotland, is to follow people up for 2 years, in fact.
Right.
So, everybody who gets a positive test is being invited to fill in a questionnaire about how they're feeling. And, if you get one of those invitations, even if you're feeling fine, it's really important to fill that out so that we know that you were feeling fine at this point and maybe later on you were not feeling fine, or what proportion of people are unwell. And we'll be asking people to repeat that very short questionnaire on a fairly regular basis up to 2 years. So that'll be interesting, and hopefully we can start to pick up these patterns where people are actually fine for a little bit of time and then maybe 6 months later are suffering from symptoms.
Okay, stay with us if you wouldn't mind, Janet, and let's go back to the phone lines and speak to Francis Simpson, who's joining us this morning. Good morning, Francis.
Good morning.
You've co-founded a group called Long COVID Kids, right?
Yes, yes.
that's because yourself and your children both had COVID and have suffered since then, and particularly your children. Can you tell us more about that?
Yes, certainly. So last March, at the beginning of the pandemic, I caught COVID. And obviously at the time, we didn't really know much about it. I mean, we had all we knew was that either the older generation or people with, clinically vulnerable people might end up in hospital, and everybody else would have something that was a bit like a flu. So when I became ill, and then both my children became ill within the same week, but all with different symptoms, it was really quite baffling. And then, I went on to, basically, we all went on to not recover from this. I think, the symptoms changed for all of us. My daughter was particularly unwell. She was 9 at the time, and she was in bed for the best part of the first 6 weeks, and with really quite bizarre and frightening kind of symptoms. So she would suddenly say, that she felt like she couldn't breathe, like her lungs felt like balloons that wouldn't blow up, or, that she just was really dizzy, she wasn't eating, she was just living on Complan milkshakes, nothing like anything I'd seen before. And then, she seemed to recover a bit. Both my children seemed to recover, and then they'd have relapses again. And both of them have carried on with this, kind of relapsing, remitting style of illness since then. So they can be all right for a while, and then, they'll overdo it, or, certain things will trigger, and then they can be back.
And how many people who, like you, parents, have sort of joined your group, Long COVID Kids? How many people are in the same situation?
We started the group at the end of October, Sammy McFarland and I, and there are now over 2,500 parents on the group, and we've actually now developed a Long COVID Kids America, Long COVID Kids Canada, Long COVID Kids Scotland. So we have Helen Goss, who oversees the Scottish part of Long COVID Kids, and she's currently, her family have just going through the second bout of COVID. So they've had long COVID. She was in the Scotsman, with her telling her story recently about her daughter who's 8 or 9, and has had long COVID since last year, and they are all sick with COVID again. So at the moment, which is why they can't come on, why she can't come on the show.
Oh, and what kind of sort of response have you had? Have you had sort of from the medical community, and sort of what sort of support has been available?
Very little. In fact, we every parent who comes on, quite a lot of our parents have stories of having been not believed, sometimes gaslighted, the sense of being told that, this doesn't happen. My own experience was similar initially, because the narrative was that children are fine. So when you're saying, actually, my child's not fine, this is not, they're not making a recovery, quite a lot of doctors haven't been particularly supportive.
This morning, we're talking about the increasing problem of long COVID. Almost 1 million people in the UK are enduring it. And this morning, we're hearing from you about your own experiences or that of a loved one. Let's go to the phone lines to Neil, who's calling us from Falkirk. Morning, Neil.
Morning, Jackie.
Thanks so much for taking the time and for holding on so long, as I know that you have on the line to share your story. Is this to do with your son? Is that right?
That's correct, yes.
Yeah, tell me about that.
In March last year, he was self-diagnosed as a physiotherapist specialist in heart and lung rehab.
Right.
In London. He self-isolated, having taken a positive test, and after negative tests, he went back to work and knew he wasn't right. Had he been in hospital, he would have got certain tests before he left. So his own hospital gave him these tests and found he had an embolism in his lungs.
Oh, my goodness.
And started treatment for that. Sometime later, he still wasn't right, and they gave him another test and discovered pericarditis around his heart. And so he was treated for both.
Right.
He was a marathon runner, like the lady that was on two calls ago. Similar thing, preparing for his 21st London Marathon, regularly under 3 hours, a very fit man at 47 years of age. And things just didn't get any better, and gradually, he began to suffer from chronic fatigue.
Right.
Now, all that time down the road, which is about 18 months now, or near enough, he's still not fit. Recently, maybe about a month ago, he tried doing a 5K. He had to watch his heart rate, of course, over all this period. He did a 5K in the time it would have normally taken him to do a 10, and it took him a fortnight to recover. So the effects of long COVID in people who are pretty fit, it is every bit as devastating as long COVID in anyone else.
I wonder, Neil, if he's sort of, some of our callers and texters are sort of saying half the... I think it is being taken much more seriously now because so many people are suffering from long COVID, but because you can't sort of see the problem and that there isn't currently a test, some people sort of feeling they're not being taken seriously. I wonder if your son felt that he was taken seriously by the people, because he's a health worker himself, and what kind of support he got.
He got tremendous support. Given he's in London and I'm up here, he got tremendous support. And there are a group of people in a similar situation in the health industry, physiotherapists, who have kind of banded together, and what they are doing, as well as being treated themselves, they are developing treatments to help other people who may have long COVID and would be looking for treatment as best they can. I would say he has been pretty well treated. He lives a fair bit away from the hospital in which he works in, and even the stress of driving or going in the tube, I think he caught it in the tube actually, they have taken that out of play, and he gets still working part-time, but he gets taxis into his work and back home. Right. For a credible distance, and this is all part of their help they're giving him, because they need him as an essential worker. Of
course. Let's go also to speak to Margaret this morning, who has been suffering from long COVID herself. Margaret, you're calling us from the Highlands. How long have you been suffering with the long COVID symptoms?
So I got COVID in March last year, so about 16 months I think that is now.
16 months. And is it all very familiar to you, what you've been hearing on the programme this morning? The fatigue, yes. The breathlessness, all the sort of the bizarre set of symptoms?
Yes, absolutely. But my main problem is my breathing and my chest pain, but I also have asthma, which has made it worse. So I've been suffering it's just continued for those 16 months, but gradually getting slightly better. But I know that I'll have a relapse if I try and do too much. But I'm an outdoor swimmer, and one of the things that I struggled with was not feeling like I could be myself during this time, because I was basically stuck indoors. Yeah. I am also a photographer, an outdoor photographer, so my life is basically quite active, well it was, outdoors, and that's what I love doing. So I found during this time that I wasn't taken seriously by anybody, I wasn't helped by anybody, so I thought, well, what can I do for myself? How am I going to get through this? So I knew that I had to keep my mind well during these months, so the mindful act, I suppose, mindful photography, just being outdoors whenever I could, and then slowly going back into the water, has been the thing that's got me through. So maybe that's slightly unique. As I talk to you, I'm sitting by Dunnet Bay, and I've just been for a little swim this morning. And then I feel slightly better, and the inflammation feels slightly better in the lungs.
Thank you so much for making the effort and taking the time to share your experience with us, Margaret, and for what works for you as well. That's vitally important, and it might inspire somebody else to try something similar. Thanks so much to Margaret for calling us, and to Neil, to Mariana. Thanks also to our expert on board, Dr. Janet Scott, clinical lecturer in infectious diseases at Glasgow University's Centre for Virus Research. And good morning to Duncan Kirkhope.
Thanks, Jackie. Good morning. Scientists believe they have discovered the basis for what could be the first diagnostic test for patients with long COVID. The team at Imperial College London told a Panorama programme presented by BBC Scotland correspondent Lucy Adams, who has long COVID, that they hoped their pilot study would ultimately lead to improved treatment. The Office for National Statistics estimates there are 81,000 people in Scotland living with long COVID. Professor Danny Altman from Imperial College.
One of the things we know for absolute certain is that long COVID can ensue from any form of infection, asymptomatic, mild, severe. So if we're heading into a phase of 100,000 cases per day in the coming months, and we're saying that 10 to 20% of all infections can result in long COVID, I can see no certainty that we're not brewing those long COVID cases despite having a vaccinated population.
And you can see Panorama, Will I Ever Get Better, on BBC One Scotland tonight at 7:35.